And I want to go back to this slide, even though we had talked about it and I kind of just, let it roll through. Let's just go back and rethink what we talked about yesterday, because we had left off at the point of the action potential. We're at a neuromuscular junction. We have to make sure that, well, we don't have to make sure, but in order for muscle to contract, that action potential that arrives at the neuromuscular junction is going to travel along that fiber. Now, hopefully you remember at this point, we mean that we're looking at a ligand-gated channel. And the ligand-gated, if we look at the area where the nerve meets that muscle fiber, there are tons of these ligand-gated channels at this area. Because once we get past this neuromuscular junction and we begin to focus on what's going to happen for the rest of that muscle fiber, we're going to be dependent on the voltage gated, and then of course don't forget our little sodium potassium pumps that kind of help make sure it returns back to rest. Now, something that I didn't point out yesterday, because we had just gotten to the point where we were talking about calcium, okay? We haven't gotten into the nerve tissue just yet, okay? And now we are at this area where I've got a nerve that's meeting the muscle fiber, okay? Just quickly take a peek at this picture. What do you see? Do you see anything up there with that calcium? Because we're not at that chapter yet. I'm not focusing on that yet, but I want you to take a peek. Do you see anything on the nerve part where the action potential is coming in? What do you see, Cam?
Going through a voltage-gated calcium channel.
We are seeing calcium play a role in this action potential transmission in the nerve. Now, I just wanted to point that out because our next chapter, we're going to talk about the activities occurring here, okay? Right now, we're looking at what's taking place at what we know as the neuromuscular junction. And remember that for a nerve cell, the product, okay, a product, of course, is a protein. And therefore, we've got our little vesicles here, okay, that are full of the product. At this point in time, okay, our neurotransmitter, the product, okay, our neurotransmitter is acetylcholine, ACH. Under the thoughts about a neurotransmitter, is that the only neurotransmitter that you are aware of? No. What other kind of neurotransmitters are you aware of? Serotonin, dopamine, we got cortisol. Now, that's going to be a little tricky, but we'll talk about that in part 2, okay? So, at this time, when we have skeletal muscle contraction, all right? When skeletal muscle contraction occurs, the neurotransmitter is acetylcholine, and acetylcholine only for muscle contraction. Now, that, okay, is the ligand. So when this little vesicle fuses to the end, what I term the terminal bud, okay, when it fuses with that plasma membrane at the end of the nerve, it spits out the acetylcholine. Okay, is everybody kind of following me? So this is now the ligand. and I'm at a point where it's full of ligand-gated channels. So the acetylcholine can fit into the receptors for this ligand-gated channel, make the gates open. Sodium is out here in the synaptic cleft, all right, and sodium will get to rush in. And that's going to happen in the tons of these ligand-gated channels, all right? So you would find tons and tons and tons of these ligand-gated channels. And if all this acetylcholine is getting released, attaching to the ligands, opening up the gates, sodium is rushing in. And therefore, if it's rushing in right here, the next points that are going to get affected are going to be starting here at the points where we find the voltage gated. If enough of this happens, all right, if enough sodium rushes in, if enough voltage gated open, and more sodium rushes in, and we have that occur, the length of that muscle fiber, that's going to trigger that threshold. And if I can trigger it in this fiber, and the next fiber, and the next fiber, and the next fiber, I'm getting all of this reaction occurring in all of these fibers, and if it gets enough of them incorporated, okay, saying, hey, come on here, let's pay attention to this, that muscle's going to contract. Does that make sense?
So when it reaches like the max, like electricity or whatever,
the voltage?
Yeah. Does the muscle contract harder if it keeps going past that?
Ah! I want you to hold that thought.
I'll try.
But the answer to it, yes. Okay? Because when we look at the changes that are going to take place, if we simply get just a little spurt of a transmission from the nerve, it might only activate 10 fibers or 100 fibers, okay? That is most likely not enough to make it go past threshold. And if we don't reach threshold, that muscle doesn't contract, okay? So, this whole process, all right, we're going to be dependent on that sodium rushing in, the changes in the voltage gates, all right, sodium continuing, getting a passage along that fiber, all right, and then how many of those fibers can we incorporate? How many can we pull in? How many of them are going to get that little signal from the nerve? All right? So, we had stopped at this point yesterday, I think, okay? And I was trying to point out some of this different anatomy that's present. And we had identified our little sarcoplasmic reticulum, the little cistern, and we had determined that in that cistern, it held calcium because the sarcomere is the functional unit of that muscle fiber. So that is the point that we have to be at, okay? So all of these activities, all of the ligand gated and the voltage gated and the, rushing in of the sodium and the changing of the voltage, all of that comes down to the sarcomere.
Do T-tubules separate sarcomeres?
The T-tubules, they are going to be, think of them as like invaginating into that fiber at the points where that end should be. Like if we're thinking Z-disc to Z-disc, that's about the point they're going to be invaginating. Because the triad, okay, when we look at the triad's going to be basically, if we begin to look at a T-tubule, that T-tubule serving the two cisternae or the two sarcoplasmic reticulum. So think of it as about coming around at the point where you would have a sarcomere to a sarcomere to a sarcomere and affecting this area of the sarcoplasmic reticulum. Does that make sense? So, if what we're trying to affect is going to be a sarcomere, note how we've got the reticulum, the cisternae, the sarcoplasmic reticulum. It looks like it's like this little portion for this sarcomere, this little portion for this sarcomere, this little portion for this sarcomere. Is everybody kind of following me? So now, if I look at an entire area of a sarcomere and I kind of blow it up so that I can see my thick and my thin filaments, all right, calcium is what's stored in that sarcoplasmic reticulum. Now, one of the things that the body is going to do, the body is going to maintain calcium levels very tightly. Very little, movement too high or too low is allowed. So calcium is actually stored in the sarcoplasmic reticulum. So when that action potential arrives, let's kind of follow once again, okay, what's happening. We're going to see that calcium gets released from the sarcoplasmic reticulum. The calcium, if we blow up the thick and the thin filament, the calcium binds to the troponin, the little 3 subunit, which has like a grasp on the tropomyosin. Okay, so calcium binds to the troponin, makes it change shape and therefore twist the tropomyosin. At rest, the tropomyosin is covering the active sites. They are not available. Because if they were available, myosin heads would continuously be stuck into the active sites, which means constant contraction. Okay? I don't know if you've ever, trust me, you don't want it in constant contraction. Okay? So at rest, the active sites are covered. When the action potential arrives, calcium gets released. Calcium is going to bind to that troponin. That troponin is going to change shape, twist the tropomyosin. That makes the active sites available. Myosin heads, they need energy. That is the point where we're going to need the ATP. So when you think about muscles and their use of ATP, this is where it's needed. Right here at the point of the myosin head.